Good day everyone, I am Juani Patangan and together with my partner Miss Aslima Rakim, we will report about dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Now what is dengue fever? I am sure you are all very familiar with this as dengue fever is endemic here in the Philippines. Now, during the first half of 2022, the number of recorded dengue cases in the Philippines reached approximately 35,000. This was about 23% higher than the total number of cases during the same period in the previous year. Now, dengue fever is an acute febrile disease caused by infection with one of the stereotypes of dengue virus, which is transmitted by mosquito genus Aedes. It refers to benign form of disease with symptoms, fever, and often rash associated with pain in joints, bones, and behind the eyes. Dengue fever is also called breakbone fever because of the severe muscle and bone pain it causes. Yung mga patients nararamdaman nila na parang binabali yung mga buto nila kaya tinawag itong breakbone fever. It is also called infectious thrombocytopenic purpura because from the word itself, thrombocytopenic, it can cause thrombocytopenia. Ito yung low platelet count in the blood. So, yung minsan yung mga patient na nakakaroon ng dengue, bumababa minsan sa 20,000 yung platelet count nila, kaya tinawag itong infectious thrombocytopenic purpura. It is also called dandy fever because accordingly, slaves in the West Indies who contracted the dengue were said to have the posture and gait of a dandy. So, ito yung posture ng dandy. So, accordingly, yung mga slaves daw sa West Indies, dati ganito yung posture, kaya tinawag nila itong dandy fever. Now, the causative agent of dengue fever is the dengue virus, which comes from the family of Flaviviridae and with the genus Flavivirus. It is an enveloped virus with single-stranded RNA. Dengue virus has 4 serotypes: the dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4. So there are 4 dengue virus serotypes and it is possible to be infected 4 times. Taliwas sa sinasabi nila na once ka lang magkakadengue. So the good news is that when you are infected with one serotype and you recover from it, you'll have lifelong immunity for that specific serotype. However, if you'll have dengue for the second time with another serotype of that virus, you are at risk of having severe dengue or dengue hemorrhagic fever. Say for example, nagka-dengue ka at yung causative agent is the dengue virus 1 and you recover from it. You will have lifelong immunity against the dengue virus 1. However, if magkaka-dengue ka in the future for the second time at yung causative agent is the dengue virus 3, 4, or 2, then you are at risk of having severe dengue or the dengue hemorrhagic fever. Dengue fever is transmitted to humans through the bite of infected mosquitoes, namely the Aedes aegypti and the Aedes albopictus. But the primary vector that transmit this disease are the Aedes aegypti. Take note that only female mosquito can transmit the virus as they need the blood protein to lay their eggs. Male mosquitoes only feed on plant nectars. Aedes aegypti is a day-biting mosquito. They appear 2 hours after the sunrise and 2 hours before the sunset, so we need extra precautions at these hours. It breeds in area of stagnant water, it has limited low-flying movement, and it has fine dots at the base of the wings and white bands on the legs. So this is exactly what an Aedes aegypti mosquito look like. So according to my research, kaya daw maraming nagkakadengue dahil hindi sila masyadong napapansin pag nangangagat kay they usually bite at the back of the neck, at the elbow, and the feet. Now, Aedes aegypti is also the same vector who transmit the yellow fever virus. Yellow fever is almost the same with dengue fever. It's characterized by a high fever, muscle pain, and joint pain. However, their difference is that yellow fever can cause jaundice. Sa dengue fever kasi hindi nakaka-jaundice yung patient. Jaundice is the yellowing of the skin and eyes, which is why the disease is also called yellow fever. Now, Aedes aegypti can also transmit the chikungunya virus. Chikungunya, which means stoop to walk, which indicates how the illness can cause great distress in the patient's joints and muscles. It's also almost the same with dengue fever. However, in chikungunya, rashes appear on the torso and the arms, while in dengue, they appear on the arms and the face. Joint pain also in chikungunya is experienced in the hands, wrists, feet, and legs, while in dengue, it is experienced in the shoulders and the knees. Another is that chikungunya can be transmitted through mosquito bites from a pregnant woman to her fetus, through sex, and through blood transfusion, but in dengue fever, the virus can only be transmitted through the bite of an infected mosquito, Aedes aegypti or Aedes albopictus. Now, Aedes aegypti can also transmit the Zika virus. Zika is also almost the same with dengue fever. However, the Zika symptoms last for a few days or weeks and then they subside. But as for dengue, the fever can last for weeks and can lead to bleeding and bruising. Another is that Zika infected people rarely get very sick to go to hospital and are unlikely to die. But those people infected with dengue usually needs hospital care because of the severity of persistent symptoms. Now, this is the chain of infection for dengue fever. For reserva, we have the humans. If you want to break this chain, humans should use mosquito repellent on shoes, clothes, and bedding. Now, the portal of exit is when a mosquito bites on a person infected with dengue. Now, the mode of transmission is through indirect contact. The mosquito will ingest the blood with dengue virus and takes 8 to 10 days to incubate. Now, the portal of entry is when an infected mosquito bites an infected person. So, if we want to break this chain, we should have a well-screened housing. Now, for the susceptible host, we have the humans with a weak immune system. And if we want to break this chain, we should wear protective clothing outside. For example, long sleeves shirt, long pants, socks, and shoes. Because as what I've said, usually yung mga Aedes aegypti mosquito nagabite sila sa at the back of the neck, sa elbow, and sa feet. Now take note that the incubation period for the dengue fever is 3 to 14 days. Now this is the pathophysiology of dengue fever. We have here the risk factors, the living or traveling in tropical areas. This is where Aedes mosquito usually breeds, and previous infection with dengue fever virus, because as what I've said, you'll have an increased risk of developing dengue hemorrhagic fever if you're previously infected with dengue. Now there will be a bite of Aedes aegypti, and then the virus will penetrate to the skin, and then it will infect and replicate inside the Langerhans cell. And then the infected Langerhans cells will go to the lymphatic system to make the immune system alert. Now it will go to circulation, which results to viremia or increase of virus in the blood. It will then activate the immune responses, including the lymphocyte. Then it will decrease the neutrophils and the white blood cells, which then the white blood cells will release the pyrogen, which will then increase the body temperature, which will then lead to dengue fever. Now, if dengue fever will be left untreated, it will lead to dengue hemorrhagic fever because of the blood vessels damage and also of the lymph node damage. Now, if dengue hemorrhagic fever will be left untreated, it will also lead to dengue shock syndrome, which is characterized by hypotachytachy or the hypotension, tachypnea, and tachycardia. Now, if this will be left untreated, it will result to death. I will explain later more on this dengue shock syndrome and dengue hemorrhagic fever. Now, this is the phases of infection for dengue fever. So, the dengue begins abruptly after a typical incubation period of 3 to 14 days, and the course follows three phases: the febrile phase, the critical phase, and the convalescent phase. The febrile phase usually lasts for 2 to 7 days and is characterized by a sudden onset of high-grade fever or a body temperature of greater than 38.5 degrees Celsius. Retroorbital eye pain or the pain behind the eyes, myalgias or the muscle pain, arthralgias or the joint pain, nausea and vomiting, epistaxis or the nose bleeding, and the bleeding gums. Another is that in febrile phase, there is a presence of maculopapular rash or PTK that usually starts in distal portion of the extremities. The skin appears purple with blanched areas of varying size. So this is the picture, and it's also called as the Hermann's sign. Hermann's sign is also called islands of white in the sea of red. So as we can see here, we can see islands of white in the sea of red. Now Hermann's sign is the pathognomonic sign of dengue fever. Now remember this, the Hermann's sign is the pathognomonic sign of dengue fever. Now after the febrile phase, it will then go to the critical phase. The critical phase of dengue begins at defervescence or after the fever has subsided and typically lasts for 24 to 48 hours. It occurs in a small subset of patients because most patients clinically improve during this phase, but those with substantial plasma leakage can within a few hours develop severe dengue, especially those patients who are already infected with dengue fever previously. Now, they have the risk of developing severe dengue or dengue hemorrhagic fever as a result of a marked increase in vascular permeability. Now, dengue hemorrhagic fever is the most serious form of dengue infection. According to the World Health Organization, any of the following symptoms is a warning sign that may signal the development of dengue hemorrhagic fever. First is the increased permeability of blood vessels, leading to plasma leakage into surrounding tissues and lack of plasma in the bloodstream, which makes the blood more concentrated. Second is the low blood platelet count or thrombocytopenia, which increases the risks of bleeding, fever that lasts for 2 to 7 days, and the tendency towards the severe hemorrhagic bleeding due to the low blood platelet count. Now, dengue hemorrhagic fever is characterized by the following symptoms. First is the abdominal pain, lethargy or restlessness, vomiting, mucosal bleeding, liver enlargement, fluid accumulation in the lungs, which are shown in X-ray and ultrasounds, thrombocytopenia, which increases the risk of bleeding, such as the hematochezia or the blood in stool, the hematemesis or the vomiting of blood, the menorrhagia or the heavy menstruation, and the epistaxis or the nose bleeding. Now, if dengue hemorrhagic fever is left untreated, it will lead to dengue shock syndrome. The term dengue shock syndrome is used when a person infected with dengue has gone into shock. Now, it is characterized by the vascular leakage or the leakage of plasma or liquid portion of the blood into tissues surrounding the blood vessels, which leads to accumulation of the fluid to organs where they don't belong, such as the lungs and the abdomen. Now, there isn't enough fluid left in the blood vessels to circulate the blood properly throughout the body. This inability to circulate the blood properly is called shock. The shock is characterized by hypotachytachy, or we have the hypotension or low blood pressure, tachycardia or increased heart rate, and tachypnea or increased respiratory rate. So, the shock can lead to organ impairment because of course, hindi na nagsisirculate ng maayos yung blood, so hindi na sila nakaka-receive ng enough oxygen to function properly, which can lead to organ failure such as acute kidney injury and liver failure. Now, if this dengue shock syndrome will be left untreated, it can lead to death to those patients who will be experiencing this. Now, as plasma leakage subsides, the patient enters the convalescent phase and begins to reabsorb the extravasated intravenous fluids and pleural and abdominal effusions. It is characterized by the resolution of vascular permeability and hemorrhagic risk. Vital signs stabilize. There is an eruption of new rash or the maculopapular rash, which lasts for 1 to 5 days and may be pruritic, so makati siya. And the patient may have chronic fatigue, which lasts from weeks to months. Now, this is a summary of symptoms experienced by patients with dengue fever from the febrile phase to convalescent phase. Now, this is the period of communicability for dengue fever. The patients are usually infective to the mosquito from a day before the febrile period to the end of it. And the mosquito becomes infective from day 8 to 12 after the blood meal and remains infective throughout its life. Now, this is the classification according to severity of dengue fever made by Halsted and Nemanitia. We have the grade 1, grade 2, grade 3, and grade 4. For grade 1, it is characterized by fever accompanied by the positive tourniquet test. The positive tourniquet test is one of the diagnostic tests for dengue fever and will be explained by Mrs. Rakim. The grade 2 dengue fever is that all signs of grade 1 plus spontaneous bleeding from nose, gums, and the gastrointestinal tract. Now, the grade 3 of dengue fever is that there is weak pulse, narrow pulse pressure, there is hypotension, cold, clammy skin, and restlessness. And for the grade 4, there is profound shock and undetectable blood pressure. Now, this is the summary. The patient will have dengue fever, and then there's a tendency that the patient will develop into dengue hemorrhagic fever, and there's also a tendency that the patient will not develop into dengue hemorrhagic fever. Now, by if unfortunate chance, the patient will develop into dengue hemorrhagic fever and it will be left untreated, it will lead to dengue shock syndrome. Now, if dengue shock syndrome will not be treated or will be left untreated, it can lead to death. Now, I have here some questions for you to review. Now, what is the other name of dengue fever? Yes, it's the breakbone fever, infectious thrombocytopenic purpura, and the Dundee fever. Next question. What is the causative agent of dengue fever? Yes, it's the dengue virus. Next question. Next question, how many serotypes do dengue virus have? So the dengue virus has 4 serotypes, the dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4. Now, what is the pathognomonic sign of dengue? Yes, it's the Hermann sign, or what we call the island of white in a sea of red. So this is the end of my part, and we will now have Mrs. Rakim to discuss to us the diagnostic test for dengue fever, what are its nursing management and medical management. Thank you.
Assalamualaikum, I am Rakim and I will be discussing to you the diagnostic tests and later on the nursing diagnosis, medical management, and nursing management, and as well as the prevention and control for dengue. So here are the diagnostic tests done to a patient to determine whether he or she is infected with dengue virus. So una dyan is itong dengue NS1-RDT, and it is used to detect non-structural protein of dengue virus. So itong protein ng dengue virus is secreted into the bloodstream, and it is detectable during the acute phase of the illness. That is why this test is requested early or during the acute phase of the illness. So a positive NS1 result, of course, confirms dengue virus infection. However, it cannot determine which of the 4 different serotypes of dengue virus is causing the infection. So a negative NS1 result doesn't rule out the infection daw. And yung mga patient na may negative NS1 result will undergo another test for the presence of dengue antibodies, and yun yung tinatawag nating serologic test. So serologic tests is used to detect dengue antibodies during acute last stage of dengue infection and to determine previous infection. So kapag daw positive yung IgM niya and low or negative yung IgG niya, na it indicates recent or early stage of the infection. And kapag daw naman positive yung IgG niya and negative or low yung IgM niya, na it indicates previous or past infection. Next, polymerase chain reaction. It detects viral genomic material in autopsy tissue, serum, or cerebrospinal fluid samples via PCR. So accordingly, this test is one of the gold standard lab tests to confirm dengue. Why? Kasi unlike sa dengue NS1 RDT test na it cannot determine the serotype, while yung sa polymerase chain reaction na not only it can diagnose dengue fever, but also it can determine which of the four different serotypes of dengue virus is causing the infection. So we also have nucleic acid amplification test, loop-mediated isothermal amplification assay or NATLAM, which is also used to detect viral genomic material. So it was introduced by the National Dengue Prevention and Control Program, and it serves as a portable molecular dengue diagnostic test that almost has the same accuracy with the PCR test. So ang pagkaibahan lang ng PCR tsaka itong NATLAM is that yung NATLAM is can be done without requiring sophisticated equipment and facility. So we also have plaque reduction neutralization test, which is used to measure antibodies that neutralize and prevent virions from infecting cultured cells. Last but not the least is the complete blood count test, which is common na ginagamit sa mga hospital, and yun nga, it is used to check for low white blood cells, low red blood cells, decreased platelet count, and decreased hematocrit. So here are the nursing diagnoses based sa nurses labs, isa siyang website. So first, altered body temperature related to dengue virus as evidenced by the vital signs secondary to dengue fever. Next, deficient fluid volume related to vascular leakage, hemorrhage, vomiting, fever, increased capillary permeability as evidenced by decrease in urine output, decrease in blood pressure, decrease in pulse pressure and volume, increase in body temperature, and increase in hematocrit secondary to dengue fever. And lastly, risk for shock related to dysfunction in the circulatory system. So sa medical management na there's no effective antiviral therapy for dengue, and what we're going to treat only is yung mga symptoms nito, like for example sa fever. So in treating fever, of course, we have to administer medication as prescribed by the doctor, and accordingly, yung pinaka-recommended daw na drug for treating fever sa mga patient na may dengue is itong acetaminophen. This drug has an antipyretic properties that can reduce fever, and this drug can also alleviate pain. So we have to bear in mind not to give aspirin and other NSAIDs like ibuprofen sa mga patient na may dengue kasi these drugs have an anticoagulant properties. So, di ba sa dengue is common sa dengue is yung pag-experience ng internal bleeding. So, alangan namang ibigay natin sa kanila itong drugs mga anticoagulant drugs nga sila. So, this may cause more bleeding sa mga patient. So, another symptom of dengue is yung dehydration. So we have to administer IV fluids sa mga patient to replace the fluids lost maybe because of anorexia, fever, or vomiting. Also, oral rehydration therapy is helpful. Next, blood transfusion and blood products. So yung mga patients na may gastrointestinal or internal bleeding may require blood transfusion and blood products. Last but not the least, Dingvaxia. So you might wonder why kasaling Dingvaxia sa medical management, knowing na naging controversial siya sa Philippines, here in Philippines, way back in 2016 to 2017 dahil nga maraming bata yung namatay after silang mabakunahan nitong with this dengue vaccine. So for clarification lang po, yung dengue vaccine, it is indicated for prevention of dengue virus infection, and it is recommended only for those people with previous dengue infection, and hindi siya pwede sa mga tao na never pang nagkaroon ng dengue infection. Why? Kasi once na gi-administer sa kanila itong dengue vaccine dun sa mga tao na never pang nagkaroon ng dengue, na magkakaroon sila ng severe dengue infection including hemorrhagic fever, which is fatal. So why does it happen? Why does it happen? So first, this vaccine po kasi na it acts like a first dengue infection. So once nag-administer siya sa person na never pang nagkaroon ng dengue infection, na para lang silang nagkaroon ng dengue infection, however wala silang mararamdamang symptoms or mild illness. However, kapag sila ay magkaroon ng subsequent dengue, like na-infect sila ng dengue virus, na yun sila na magkakaroon sila diretso silang magkakaroon ng severe dengue. So hindi na siya mild lang, kundi severe talaga yung mararamdaman nila, and it includes hemorrhagic fever, kaya siya fatal po yun siya. So moving on sa nursing management, the first thing we have to do for a patient na may dengue is assessment. So this assessment include patient's temperature, heart rate, and blood pressure. Next, yung patient's capillary refill in skin. So sa patient's capillary refill, we all know naman na kapag slow yung capillary refill ng patient and may pagkapalo siya, then it indicates reduced blood flow. And sa skin naman, na kapag may makita tayong mga red rash or yung tinatawag nating PTK, which is yung pinaka-common na hemorrhagic manifestation na ma-observe natin sa patient na may dengue, na it indicates internal bleeding po. So, assessment of evidence of bleeding, yung nasabi ko, yung PTK. Tapos, sa other sites, yung bloody urine and bloody stool. So, assessment of increased capillary permeability. So, an increased capillary permeability indicates internal bleeding po. So, we have to assess urine and stool output. Next, we have to monitor the vital signs and fluid intake of the patient every 4 hours. We have to keep the patient at rest during bleeding episodes. So in case na magka-nosebleed yung ating patient, na we have to keep his trunk elevated and apply ice bag to the bridge of his nose para ma-constrict yung blood vessels niya and to help stop blood from flowing. So we can restore blood volume by putting the patient in Trendelenburg position para mag-provide na greater blood volume sa head part. So, Trendelenburg position is helpful in causing auto-transfusion of blood to the central circulation. Next, we have to observe for signs of shock, such as slow pulse, cold clammy skin, prostration, and fall of blood pressure. We have to apply non-pharmacological therapy like bed rest and tepid sponge bath sa patient. So, we have to avoid dark-colored foods, like also caffeine and spicy foods. So why dark-colored foods? Dark-colored foods kasi once nag-vomit yung patient, na it may resemble blood, and yung doctor na pwede siyang ma-confuse kung yung gi-vomit ng patient is blood ba or food siya which is dark. So yung doctor is hindi niya makikita yung progression ng disease. So, why caffeine? So, yung caffeine kasi na it contains diuretics. So, we all know naman na yung diuretics na it can excretes water as urine. So, hindi pwedeng uminom yung patient na may caffeine kasi yun nga, di ba sa dengue na one of its symptoms is dehydration. So, mas magkukos yun, mas magkukos or mas magkaka-experience yung patient ng dehydration once na uminom yan siya ng mga caffeine. Once uminom yan siya ng caffeine. So, spicy foods. Patients should avoid spicy foods kasi it stimulates the stomach to produce more acid which irritates the wall of stomachs and it can cause bleeding po. So next, we have to give foods enriched with vitamin C to boost the patient's immune system, vitamin K para sa blood clotting, and iron for to help produce more blood cells. So oxygen therapy, we have to provide oxygen for patient in shock to avoid more severe complications of dengue. So, we have to keep patient in a mosquito-free environment. And lastly, patient with dengue is not infectious, therefore, isolation is not required. So, what are the prevention and control we can do? So, we have 5S provided by the DOH. And before kasi na 4S lang siya and now is gidagdagan nila ng isa pang S which is itong sustained hydration kaya siya naging 5S. First, search and destroy. In here, palitan daw ang tubig sa mga flower vase at linisin ito minsan sa isang linggo, takpan ang mga timbo o iba pang imbakan ng tubig, itaob ang mga bote at lata at iba pang mga kagamitan na maaaring pag-ipunan ng tubig at pangitlugan ng lamok. Second, seek early consultation. So kapag ang isang tao ay nakaramdam ng lagnat ng 2 araw, agad na kumonsulta sa doktor sa pinakamalapit na hospital or health center. Third, secure self-protection. So iwasan ang maiikling kasuotan upang hindi madaling makagat ng lamok. Magguhod ng mosquito repellent at sabon na may moisturizer. At gumamit ng kulambo sa pagtulog, umaga man o gabi. Fourth, sustain vector control measures such as spraying, misting, and larviciding. And lastly, sustain hydration. So, kailangan panatilihin ang pag-inom ng oral rehydrating solution o paglagay ng swero kung kinakailangan. So, that would be all po for our report. I hope po may natutunan po kayo sa aming report.